And actually, smoke is not good for patients either, whether it's cumulative,
Yeah.
when it's in a laparoscopic or in their monitored anesthesia care delivery. So, to advocate for that is to understand and be knowledgeable about what our potential exposure rate is in something like this.
Mhm.
How I started in Emory, that was an easy conversion. Emory University Health System. And I just went straight to the safety committee, infection prevention. I showed them the data and they went, oh my gosh, we have to do this. Boom, it was done. So I
Yeah.
think you got to talk to the right people that are going to help
Mhm.
support you. You definitely, as a staff nurse, you've got to prove the financial analysis and how that will impact you.
Mhm.
I'll give you an example of the impact. It's probably less than $20,000 per year per department from my financial impact
Mm.
to make my team safe.
Right.
And I'll tell you, DNV and the OSHA alliance we have with ANMED loved what we're doing to help protect staff. Today's world is we are kind of scarce with the nursing shortage and all. And
Mhm.
if now more
Yeah.
than ever, we have to take care of our team. So it's
Yeah.
advocacy is what it is.
Absolutely. Absolutely. That makes so much sense. And I know that we were talking a little bit about legislation. I mean, is there anything that we can do on that front to, help our states, kind of like facilitate on the legislative end?
Absolutely. Well, that's of course getting nurses that are passionate, and definitely from state to state there are. It's moving much faster. Where it was, it started in California 10 years ago and stalled, and they went through OSHA. Oh, I think I'm
Mm.
trying to think what the acronym is for OSHA, Cal OSHA or something like that.
Mhm.
And then all of a sudden, it took a nurse who stood up with a lung transplant in Rhode Island to push the first bill that went into law. How we can get started is not only nurses that are passionate and educating our legislators and our senators, but
Yeah.
AORN, our Association of Perioperative Nurses, will help support states with lobbyists and the Georgia, like
Mm.
the Georgia Nurses Association. You're going to get involved there and bringing everybody together. And that's what we're doing in Georgia. But every
Okay.
state is replicating the same process and actually being very successful at it.
Yeah, I was gonna say what states seem like they're pioneering this, front to for safer workplaces.
There is Colorado, and there is Rhode
Mm.
Island, there is Kentucky. I forgot about it. There is Illinois, and there's Oregon.